A great example is the fact that I opened up a telemedicine practice prior to COVID, and it completely got shut down by everybody I talked with. I guess the patients were always really very supportive, but when I would talk to colleagues, they just basically looked at me like I was crazy. Interestingly, COVID tanked my business, but it was proof of concept. And that's for a different episode. But I have always had ideas that weren't always well supported. But at the same time, I've started to learn that when people don't support my ideas, or the more adamant they tell me that it's not going to work, essentially, I know I'm knocking on the right door. So it was really nice talking with other disruptors, other people who think outside of the box, other people that at least acknowledge the actual problem. I think a lot of physicians and people in the healthcare space, we just keep our head in the sand and hope things get better. But the unfortunate truth is that it's not. At these national meetings that I go for, PM&R, again, the focus is mainly clinical aspect and other things. But at what point does the business of healthcare delivery, not even business administration, but at what point is that part of the agenda where we take a look at how we are delivering care as a system and question whether or not it's actually working? It might be one or two lectures per year, but it is definitely not the emphasis. And I know that there are people out there that have been advocating everything that I've been saying right now for years. I know I'm not the first person, but it was really very nice to attend a conference where people supported one another. We exchanged ideas. There was just a general excitement. It was also great to see medical students. I met several medical students at the conference, ranging from first year to fourth year, and I loved talking to them. It took me back to my earlier days when I did all my medical and resident education and advocacy work. I will start to add a little bit more content about direct care as I move forward on this platform, because I'm starting to realize that I have a pretty wide reach. Some of the people that have been contacting me aren't just physicians or physical therapists.